Hello, everyone. My name is Anita Iyer, and I run Ekans Trust in Pune. Demystifying Disabilities is our video series of interviews with experts from the medical field, where we talk about disability prevention, detection or diagnosis, and early intervention. Today, we have with us Dr. Anil Patki, who is a dermatologist. Welcome to our series, Dr. Patki.
Yeah, thank you.
Dr. Patki, our first question to you is, what are the different disabilities that you actually come across in your line of work, and how often do patients with disabilities come to you?
Yeah. Mainly disabilities come because of different diseases like leprosy and psoriasis in our field. And in case of leprosy, as far as leprosy is concerned, leprosy, as you know, is a disease of skin and nerves. So, because of affection of different nerves, the patients may land up with deformities if the patient's case is not detected early enough and not treated promptly. Leprosy, the nerves are affected in hands, feet, and face. So, in case of hands, because the nerve is affected, the hand may become insensitive or anesthetic, and then the patient does not feel any injury or any pain while he is getting injured or burnt. So, that is one cause of the deformities. Second cause is the paralysis of the small muscles of hands and feet. So, that can give rise to a deformity which is known as claw hand. There are three main nerves in the hand, in the upper limb, that is the ulnar nerve, the median nerve, and the radial nerve. In leprosy, the ulnar nerve and median nerve are commonly affected. When the ulnar nerve is affected, the patient gets clawing of two fingers, the little finger and the ring finger, and that gives rise to hyperextension, something like this: hyperextension at metacarpophalangeal joint and flexion at interphalangeal joint. So when these two fingers are affected, this is known as ulnar type of claw hand. And when the median nerve is also affected, the patient develops total claw hand, and it is something like this. And the hand becomes completely useless as far as the work is concerned. So these are major deformities of the hand in case of leprosy: the ulnar claw hand and the total claw hand. So these were very common in the past, say around 30, 40 years ago. But nowadays we have controlled leprosy to a great extent, and we don't see such deformities quite frequently because the patients are diagnosed earlier and treated before they land up with the deformities. Another horrible type of deformity is the absorption or loss of fingers and toes. So that used to happen in the good old days, and that the reason for that was recurrent injuries, repeated burns, which are not noticed by the patient and not taken care of. Other thing that we see commonly is the deformities of the feet. Similar to hand deformities, a patient can develop insensitive feet, and when walking, they don't feel any injury. If they are hit by a thorn or a nail or a stone, they won't feel any injury and they will keep on walking. And then the injury becomes infected, and then it forms a trophic ulcer. So ulcers on the feet is one of the common major problems giving rise to deformities and disabilities. The third major problem is in the face. When the facial nerve is involved, there could be paralysis of the muscles which close the eye. So the patient is unable to close the eye. Even during sleep, the eye will remain open in such a case. And this deformity is known as lagophthalmos. Lagophthalmos means inability to close the eye. And that exposes the cornea of the eye to weather conditions, to dust, to wind, sunlight, and other injuries. And that can give rise to blindness. So these are the three major things that we see as in leprosy as deformities of the hands, feet, and face. So mercifully, because we have eliminated leprosy as a major public health problem, the incidence of deformities is going down. It has substantially gone down. So when I started my practice, the incidence of leprosy was 5 per thousand in India, 5 per thousand, and today it is less than 1 per 10,000. So that is what we have achieved during last 30, 40 years, majorly because of the multi-drug therapy that was recommended by WHO, in which we give either two drugs or three drugs to the patient depending on the bacillary index or the depending on the bacillary load that is present in the body. For severe or lepromatous type of cases, which we call multibacillary cases, we give three drugs for almost 1 to 2 years. And for patients with lesser type of possibacillary type of leprosy, where the patient has only one or two patches on the body, we give 6 months therapy. So that has achieved quite a good number of reduction in the total number of cases. But still, the problem is that the incidence is not increasing. That means we are getting new and new cases. That means the transmission is persisting in the society. We are getting child cases also. So that is the problem now. But early treatment and counseling of the patient and early treatment as well as regular treatment uh, prevents all these deformities. Another cause for deformities in leprosy is a condition which we call lepra reactions. There are reactions. See, leprosy is a very chronic disease. It doesn't give rise to pain by itself. But sometimes what happens that the immune system reacts. Just like you must have heard about this cytokine storm in COVID patients, which is just an immunological reaction. Similarly, the body can have immunological reaction in leprosy also, and these reactions are known as lepra reactions. In during the course of lepra reactions, the patient may suddenly have a paralysis of the eye muscles, or paralysis of the hand, or paralysis of the leg, which can give rise to foot drop. That means the foot drops while walking. So this is another deformity that we see in leprosy. So lepra reaction, management of lepra reactions, early detection of the treatment, early detection of the patient, and prompt treatment, regular treatment are the factors which have limited the number of patients with deformities in today's world.
When you're talking about lepra reactions, are these temporary or are these permanent ones? There is a foot
There
drop.
are two types of reactions. There is type 1 reaction and type 2 reaction. There are two types of immunity. One is known as cell mediated immunity, the other is known as humoral immunity. Humoral immunity means the body forms antibodies against the antigen. And cell mediated immunity is the immunity which is mediated by the lymphocytes. So a patient who has type 1 reaction is because of this increase or decrease in cell mediated immunity that can go on for a very long time, months together. And type 2 reaction, which is seen in lepromatous leprosy, is because of antibody formation, that is humoral immunity. And that is a very sudden condition where the patient gets suddenly fever, body ache, all red lesions, nodular lesions on the body, face, and fever and severe joint pains. So that is an episode which may last for a few days, but some patients develop recurrent type of ENM.
Okay.
So in some patients, the reaction may be short lasting, but in few patients, it can go on for months to years.
So there are also other repercussions like on the mental health of the patient because of the kinds of stigmas that are attached to leprosy.
Yes.
Because while you were speaking about how the patient should be aware and the patient should be alert and immediately get treatment and be prompt about taking treatment, it is also society that has assigned such a big stigma to this particular disability and
Yes.
condition,
Yes.
skin condition. Not only
Yes.
leprosy, also psoriasis, because a world that focuses so much on the aesthetics about how a person
Yeah.
looks, this
Yeah.
is something that is immediately seen. What would you like to tell general society, not only about the stigma but also about this myth that leprosy can spread by touching a patient with leprosy? How does leprosy spread? If you could just give us a few
Yeah. Yes.
um, tips. Yeah.
Leprosy basically spreads by droplet infection, just like tuberculosis. So, when an untreated patient is moving around in the society, he is coughing, sneezing, spitting, the germs are thrown in the air in the form of droplets, and the patient, the general public is exposed to the infection. So in case of leprosy and TB, many normal individuals in the society are infected, but they don't have the disease because their immune system is good. So in case of leprosy and TB, there is a difference between infection and disease. Infections means just entry of the organism into the body, whereas disease means the manifestations of the disease seen on the body.
Right.
So most of the patient, most of the general public is resistant, so they don't have the disease. Even if the organism enters their body, their immune system kills the organism. So just by touching the patient, nobody gets leprosy. Leprosy spreads by droplet infection. So the leprosy germ does not know whether a person is rich or poor, whether he is, what is his caste, what is his religion. Anybody can get infected. So most of the people are infected moving around in crowded places, and therefore anybody can get the disease.
So how do we understand, what are the first symptoms of leprosy
The
that
first
people should know?
symptoms of leprosy are mainly on the skin. The patient gets either a hypopigmented or light colored patch or a reddish patch on the body, which does not pain, which does not itch, and therefore it is neglected. So earlier, when we had leprosy control programs, the leprosy workers used to go from house to house for a survey to check the body, whole body, because if a person has got a patch on the back or on the buttocks, he cannot see, and therefore he will not report it to the doctor. So there were advertisements like Chatta Disla Doctor La Beta. So that is the main thing. Whenever there is any skin patch, or there is a one type of leprosy where there is no skin involvement, only the nerves are affected. That we
Oh,
call pure neuritic leprosy or polyneuritic leprosy. In that particular condition, the patient will present with either loss of sensation in the hand, or tingling numbness, pain in the hand, or paralysis or deformity of the hand, or a foot drop, or things like that. So the leprosy, one must remember that leprosy is a disease of skin and nerves. So the manifestation will be either on the skin or in the form of nerves like paralysis or loss of sensation. So in any of these conditions, if the patient develops such a thing, patient should immediately consult a doctor and get himself diagnosed and treated.
so general physician should be very aware and alert also to know that, if a patient
Yes,
presents with such a
yes.
patch,
Yes,
um,
many patients go first to orthopedic doctors because they have pain in the hand, tingling in the hand, and things like that. And then, therefore, sometimes the cases are the diagnosis may be delayed.
correct. So very often, do you think even now people come to you a bit too late to
Yes, sometimes
consult you and to see?
one or two patients of Clohine we see in a year now. Earlier, we used to see quite a lot, large number of cases.
Right,
So
and they
now,
all
the
seem.
incidence, mercifully, now the incidence is quite less.
Also, we found that people with leprosy all seem to be living together in one single area because of the stigmas that were attached to the disease
Yes,
earlier.
yes.
And do you agree with that particular
Not at all, not at all.
kind of idea where they stay in the
He
same
has been
place?
associated with social stigma right from medieval times. In medieval Europe, when a leprosy patient used to walk on the road, he has to sound a bell so that other people should go away and he will walk through the. It was very very bad. Isolation has always been there since the medieval times. There's a story of Mahatma Gandhi when he was invited to inaugurate one leprosy colony or leprosy hospital. He told me that I am not happy that you are calling me here. I will be happy if you call me to close down this hospital. So there should not be a segregation of family or segregation from the family or segregation of the patient from the society. Because, but in earlier times, before 1960s or 1940s, there was no treatment for leprosy. So segregation was one of the measures. But since now the treatment is available, powerful bactericidal drugs are available, the patient, even if he's infectious patient, becomes non-infectious in a few days once we start the treatment. So
Right.
there is no need to isolate the patient. Patient can work, patient can stay at home, and patient can take treatment at home.
You mentioned psoriasis, doctor,
Yeah.
which is also listed as a disability abroad, but not yet in India. I guess psoriasis also leads to arthritis eventually in some people.
Yes. Yes.
What would you like to say about that skin condition?
Psoriasis is also a very great problem it is becoming because in the West, the prevalence of psoriasis is around 2% of general population. But in India, it is not that high. But we do get patients with psoriasis. Psoriasis is a skin disease where there is hyperproliferation of the cells. That means the multiple number of cells are formed on these patches. The patient gets red patches with silvery white scales on these patches, and they itch and they burn, and it is not visibly, very uh, great to see a patient having patches, these red patches with whitish scales all over the body. It is not an infectious disease. Psoriasis is a genetically predisposed disease. It is a polygenic multifactorial disease. That means there are several genes involved. That means the patient has an inborn tendency to develop psoriasis. Plus, there are certain external factors which exacerbate psoriasis. Only 5% of the psoriatic patients have arthritis. Only
Oh,
5%, not more than that. So that is not a major problem, but when it happens, it becomes a major problem for the person. Stigmatization of psoriasis is also very common. There was a person with psoriasis who came to me to get a certificate that they were not allowing him to visit the swimming pool and use the swimming pool. I gave him a certificate, but in spite of carrying certificates from several doctors, the authorities at the swimming pool did not allow him to use the swimming pool because they thought that other people, when they see you swimming in this pool, they will not come to our swimming pool. So that is how the story goes about psoriasis. Sometimes psoriasis affects only palms and soles, and then the patient becomes stigmatized. He becomes depressed, and even there are studies which show that 5 to 10% of psoriasis patients have suicidal ideation, and they are even they are ashamed of shaking hands because if the lesions are there on the hands. The handshake is such a common thing, and in the society during the course of business they are ashamed of shaking hands with the person, and that's why there is stigmatization of psoriasis. There is a study, there are quantitative studies to measure the disabilities, that is known as quality of life index.
Right.
There are certain questionnaires which the patients have to answer, and depending on the answers there are certain scores. So that is how the quality of life is determined. So when quality of life indices are index is measured for psoriasis patients, it was found that it is as great as the disability caused by cancer, diabetes, or ischemic heart disease, or psychological depression. So the quality of life is as depressed as patients of cancer or ischemic heart disease or diabetes in patients with psoriasis. The other major problem with psoriasis is that the media paints a very poor picture of psoriasis. Not all the patients of psoriasis will have extensive disease. Most of the patients will have a disease which is limited to either scalp or palm, soles, elbows, knees. That is not much of a disability. But what happens is that once you give him a diagnosis of psoriasis, the patient immediately goes home. He just Googles, finds out the pictures, and he sees horrible pictures of patients having great lesions all over the body, and he becomes so much afraid and depressed. So we most of the times I advise patients not to see Google sites, because the knowledge is a double edged sword.
Correct.
मराठीत
True.
म्हणतात की अज्ञानात सुख असतं, अज्ञानात सुख असतं. So we are happy if we don't have the knowledge. But the patient sees a severely affected psoriasis and arthritis and deformed hands and feet, and the poor guy is having just lesion on two elbows. That's all, and he's afraid of getting lesions all over the body and getting deformities. So that is not the case. For each and every psoriasis patient will not have horrible deformities. So
That is
if
true.
the lesion is limited only to the scalp, it is just sometimes it is just like dandruff. So he just has to use some lotion and shampoo once in a week, and it's under control. So all patients of psoriasis need not be that much worried about the condition, and it can be kept under control. And most of the times, the thing is that counseling is very, very important in case of psoriasis.
And it is not a curable disease, it can only be managed, right?
It can just be controlled like diabetes or hypertension. In the first visit itself, we tell the patient that don't go to the people who advertise that they will cure your psoriasis. If somebody cures psoriasis, he will get a Nobel Prize. So don't believe in such things. We have to control it, and because it is a genetic disorder, nobody can change your genes. No
Right.
pathy, allopathy, homeopathy, allopathy, no pathy can change your genes, and it's a polygenic multifactorial disorder that is going to last. This tendency is going to last for life, but we can control it so that your survival is not affected, your working ability is not affected, and you can easily live a normal life.
Are there any other disabilities or diseases
Atopic
related
dermatitis. Atopic dermatitis
to,
is another thing that is, that is
like
becoming very
eczema?
common nowadays. And atopic dermatitis, around 10% of children are now being affected by atopic dermatitis. And atopic dermatitis mainly presents either in infancy or childhood. because of dry skin, the skin becomes extremely itchy, irritable. The child scratches, becomes irritable, doesn't sleep, doesn't allow the parents to sleep, and the quality of life of the parents also becomes very bad. And atopic dermatitis is aptly described as the itch that rashes and not the rash that itches. It's
Oh,
the itch that rashes and not the rash that itches. So the skin is extremely sensitive, and it is sensitive to irritants in the environment. Irritants like, woolen clothes, synthetic clothes, hot water, cold water, contact with wool. So all these will produce severe itch, and the child scratches, and the scratch skin becomes thick, and thick skin becomes more itchy. So the child scratches it more, so it becomes even more itchy. So it's a vicious circle: itch, scratch, itch, scratch, itch. So this goes on and on and on. And it has been found that if you immobilize the hands or tie up the hands, everything will subside because they cannot scratch.
oh,
So
okay,
scratching will exacerbate atopic dermatitis. So atopic dermatitis is increasing in the West. It has become a major serious problem, and in India also it is now increasing. And we are seeing more of atopic dermatitis in Indians who are who have migrated abroad and they had children abroad. And in them, the incidence of atopic dermatitis is quite high. And severe atopic dermatitis we are seeing more and more commonly.
okay. So there is no cure again for atopic dermatitis
You
either.
can only control it, but mercifully, atopic dermatitis is a self-limiting disorder, and as the child grows up, most of the patients will get the natural remission, and
Okay,
very few develop atopic dermatitis or continue to get atopic dermatitis in adulthood.
okay,
And those with severe atopic dermatitis, we have to treat them with immunosuppressant drugs.
okay. So, are there any cases that you would like to talk about? Any cases of the different skin conditions that you spoke about just now? Do any
I
cases
remember
come to
only
mind?
one case. She was, it was around say 20 years ago, and a young lady just recently married, and she was working as a teacher. And she was given a diagnosis of leprosy. She was having one or two patches on the body, and she came to my clinic. She was incessantly crying, and when I asked her, she was afraid of number one, divorce, and number two, loss of the job. So it took me a long time to convince her that there is no need to worry. You will not lose your job. You are having only two patches on the body. I'll give you a certificate. You are not infectious. You can mingle with the children. You can teach the children. There is no harm in your continuing with as a teacher. And as far as your parents and in-laws are, your husband and in-laws are concerned, you bring them to me. I'll convince them. I'll tell them about the disease, and then there's no need to worry. So she went back. She brought back her husband. I just at that time, mercifully, I had written one article in a newspaper. So I just gave that article to him to read. So he read about it. He was an educated fellow, and then he was convinced. And then this lady was, a little bit calmed down. So this is one story. Mercifully, now they have removed leprosy as a ground for divorce. Both
Okay,
Lok Sabha and Rajya Sabha passed the. It was in 2019. There are so many archaic laws in our country, and most of these have to be scrapped. And this government has started scrapping those laws, and this leprosy as a ground for divorce existed for such a long time. It's difficult to believe that in the year 2019, that is only 2 years ago, the parliament passed the law to
wow.
scrap the leprosy as a ground for divorce.
Is it only leprosy, or is it all of the other conditions also that we spoke about?
No,
Because there
I
was
don't.
with
I
psoriasis,
don't.
etc.
No, no,
Also,
no, no. Leprosy was there. This was included in British times when there
right,
was no treatment for leprosy. Leprosy was a ground for divorce when there was no treatment for leprosy.
right.
This should have been scrapped 50 years ago.
It's good to know that good changes and positive changes are coming
Yeah.
now in society, and
Yes.
disabilities are being spoken about. Doctor, this is one of the reasons why we are having these conversations. Because,
Yeah.
see, talking about leprosy, People don't have discussions about leprosy. You don't talk about disabilities also at the dining table. These are not
Yeah,
conversations that people have, and we should have them.
yeah,
Also, I constantly keep saying, I think as Indians, we have always been ashamed of the wrong things. Where we really need to be ashamed, we seem to, not bother too much, and where we don't need to feel shame. Like, when you have a disease or a disability, it is not a matter of shame. It is a matter of fact, and it is something that needs to be treated, and we need to get on
yes,
with life. So it's
yes.
wonderful that you've spoken to us about something that has been so stigmatized over centuries, I think, not just decades. And is
Yeah.
there any message that you would like to give to society so that people with different conditions like these are not stigmatized or discriminated against?
Yeah. See, most of the skin conditions are not to be feared of. There is a treatment for many of these conditions, and patients should not hide their disease. Many times patients will keep on hiding the disease for the fear of getting stigmatized, and then the disease spreads and involves different organs, and it spreads to become a very large problem. So patients should come up early for treatment. They should believe in their doctors, and they should take proper treatment as suggested by the doctors. And of course society should be supportive, or family members should be supportive of them, so that they can have a normal life.
Thank you so much, Doctor, for your time for this interview and all the insights that you have given us. Thank you very much. Thank
Okay.
you, MQ Pharmaceuticals, for being our sponsors. Thank you, Team Ekansh, Priyanjali, for being our backend support. We hope that our viewers will learn from this interview not to discriminate against persons who have skin conditions, and that people with skin conditions will also take courage, having listened to the doctor, having given us so much advice. Thank you so much.
Okay, thank you.